Hi, I'm going to talk about psychoanalytic therapy and what I thought was valid and what I thought was not so valid. The one thing that I started to think about after reading all of this, the one phrase that came to my mind was, your unconscious is ruling over your conscience, but you're not conscious of it. That's the one thing that kind of kept coming in my head about this type of approach. I do believe that some of our unconscious definitely comes out in our behaviors and in our actions, and we need to find ways to handle that and to be aware of that and where that's coming from. However, I do disagree for now that these some of these traits are born in us and that they are developed in the developmental stages and they stay with us and then they are transferred over into adulthood. I don't necessarily agree with all of that. What I also don't really like about this sort of therapy is one example in the book was the blank screen. So the therapist doesn't show much emotion. They just sit there and listen and are very straightforward. They don't show empathy or anything like that. And for me, I don't think that's the type of counseling that I want to do, and I just don't know how that would affect the patient. What I did like about parts of this therapy was the free association, having a client sit, and just be able to become vulnerable and to just start talking and to start, coming up with words, right off the top of their head. I think that's beneficial. I think that can help the therapist learn more in depth about what's going on with the client. And I think it also helps the client because they can become vulnerable and really start to see what their mind is doing and see what's being reflected when they speak. So that was one thing that I did, the free association. I did find that to be beneficial, and that would be a sort of technique that I would like to use. Alrighty, thanks.